Our bodies are intricate networks of communication, constantly sending and receiving signals. The sympathetic nervous system, or fight or flight response, is a key player in this system. It prepares our bodies for action, hearts beat faster, blood vessels constrict, and energy is mobilized. Chronic stress can keep this system on high alert, causing high blood pressure and heart disease. Alpha and beta blockers help by blocking certain chemical messengers. These medications calm the body and reduce cardiovascular strain. They act like keys fitting into specific locks or receptors on cells. Alpha blockers target alpha receptors, while beta blockers target beta receptors. Blocking these receptors mutes fight or flight signals, aiding in managing health conditions. Understanding their differences, mechanisms, and effects is crucial for patients and healthcare providers. Imagine your blood vessels as a network of highways, with traffic constantly flowing through. When the fight or flight response kicks in, these highways constrict, making it harder for blood to flow freely. Alpha blockers act like traffic controllers, easing the tension in the walls of blood vessels, particularly in the arteries and veins. This relaxation allows blood to flow more easily, lowering blood pressure and reducing the workload on the heart. Within the realm of alpha blockers, we encounter two main subtypes: alpha-1 and alpha-2 receptors. Alpha-1 receptors are like the main gatekeepers on these blood vessel highways, primarily responsible for the constriction response. By blocking these receptors, alpha-1 blockers effectively open up the gates, promoting vasodilation. On the other hand, alpha-2 receptors play a more complex role. They can be found on both the nerves releasing the fight or flight signals and on the blood vessels themselves. Blocking alpha-2 receptors can have a two-pronged effect. It can reduce the release of these stress signals while also potentially contributing to vasodilation. The distinct actions of alpha-1 and alpha-2 receptors highlight the intricacies of our body's regulatory mechanisms. Understanding these nuances allows healthcare providers to tailor treatment strategies, selecting the most appropriate alpha blocker based on the specific condition and desired effect. Alpha blockers have earned a well-deserved place in the management of various health conditions. One of their primary uses is in treating hypertension or high blood pressure. By relaxing blood vessels and improving blood flow, alpha blockers help lower blood pressure, reducing the risk of heart attack, stroke, and other cardiovascular complications. Beyond their blood pressure lowering effects, alpha blockers have also proven valuable in addressing issues related to an enlarged prostate, a condition known as benign prostatic hyperplasia, or BPH. The prostate gland, responsible for producing seminal fluid, often enlarges with age, putting pressure on the urethra and leading to urinary problems. Alpha blockers, particularly those targeting alpha-1 receptors, can relax the muscles in the prostate and bladder neck, easing this pressure and improving urine flow. This makes them a valuable tool in alleviating the bothersome symptoms of BPH, such as frequent urination, weak stream, and difficulty emptying the bladder. Furthermore, alpha blockers play a crucial role in managing a rare tumor called pheochromocytoma. This tumor, typically found in the adrenal glands, releases hormones that can cause severe spikes in blood pressure. Alpha blockers help control these blood pressure surges, acting as a critical part of the treatment plan for this condition. While generally safe and effective, alpha blockers, like all medications, can cause side effects. Understanding these potential side effects is important for both patients and healthcare providers to ensure appropriate monitoring and management. One common side effect, particularly with the first dose, is orthostatic hypotension, a sudden drop in blood pressure upon standing. This can lead to dizziness, lightheadedness, or even fainting. To minimize this risk, it's crucial to start with a low dose, gradually increasing it under medical supervision. Patients should also be advised to change positions slowly, especially when getting out of bed or a chair. Another potential side effect is reflex tachycardia, a compensatory increase in heart rate that can occur as the body tries to adjust to the blood pressure lowering effects of alpha blockers. This increase in heart rate is usually mild and temporary, but it's essential to monitor for any palpitations or racing heartbeat. In some cases, dose adjustment or switching to a different medication might be necessary. Additionally, some patients may experience nasal congestion, headache, or dizziness as their bodies adjust to the medication. These side effects are usually mild and tend to subside with time. However, it's important to communicate any persistent or bothersome side effects to your healthcare provider, as they may indicate a need for dose adjustment or a change in medication. Section 5. Beta blockers. Slowing things down. Beta blockers are like calming diplomats, reducing the activity of the sympathetic nervous system. They target beta receptors on cells in the heart, lungs, and blood vessels. Adrenaline binds to these receptors, making the heart beat faster, blood vessels constrict, and airways dilate. Beta blockers block these receptors, reducing these effects. There are different subtypes of beta receptors, each with unique functions. Beta-1 receptors in the heart control its rate and force. Blocking these receptors slows the heart rate, reducing its workload. Beta-2 receptors in the lungs relax the airways. Blocking these can narrow airways, problematic for respiratory conditions. This distinction is crucial for selecting the right beta blocker for patients. Section 6. Beta blockers, a versatile tool for heart and beyond. Beta blockers, with their ability to dampen the fight-or-flight response, are key in treating cardiovascular conditions. They shine in managing hypertension by lowering heart rate and blood pressure. This reduces strain on the heart and blood vessels. Beta blockers are crucial in managing heart diseases and preventing repeat heart attacks. They improve heart function in congestive heart failure. By reducing the workload, they protect the heart from further damage. Their benefits extend beyond the cardiovascular system. They manage arrhythmias, glaucoma, migraines, tremors, and anxiety. This versatility makes beta blockers essential in healthcare. Section 7. Potential side effects of beta blockers. What you need to know. Like any medication, beta blockers can cause side effects, and understanding these potential effects is crucial for both patients and healthcare providers. One of the most common side effects is bradycardia, a slower than normal heart rate. While often mild and asymptomatic, bradycardia can sometimes lead to fatigue, dizziness, or lightheadedness. Another potential side effect is bronchoconstriction, a narrowing of the airways, which can be particularly problematic for individuals with asthma or chronic obstructive pulmonary disease, or COPD. Beta blockers, particularly those that block both beta-1 and beta-2 receptors, can exacerbate these respiratory conditions, leading to shortness of breath, wheezing, or chest tightness. Patients taking beta blockers might also experience fatigue, cold hands and feet, and sleep disturbances. These side effects are usually mild and tend to subside with time. However, it's important to report any persistent or bothersome side effects to your healthcare provider. It's important to note that beta blockers should not be stopped abruptly, as this can lead to withdrawal symptoms, including a sudden increase in blood pressure or heart rate. If discontinuation is necessary, it should be done gradually, under the guidance of a healthcare professional. Section 8. Alpha versus beta blockers, choosing the right tool for the job. While both alpha and beta blockers influence the sympathetic nervous system, they do so in distinct ways, making them suitable for different clinical applications. Alpha blockers, by primarily targeting alpha receptors, excel at relaxing blood vessels, making them particularly useful in managing hypertension and BPH. Their ability to ease the tension in blood vessels translates into lower blood pressure and improved urine flow, providing relief for patients with these conditions. However, alpha blockers have a limited role in managing heart rate or rhythm abnormalities. Beta blockers, on the other hand, take a more direct approach to calming the heart. By blocking beta receptors, they slow down the heart rate, reduce its force of contraction, and stabilize its rhythm. This makes them a cornerstone in managing conditions like hypertension, heart failure, and arrhythmias. However, their potential to cause bronchoconstriction limits their use in patients with asthma or COPD. Understanding these key differences is crucial for healthcare providers when selecting the most appropriate medication for a particular patient and condition. The choice between an alpha blocker and a beta blocker, or even a combination of both, depends on various factors, including the specific condition being treated, the patient's overall health status, potential drug interactions, and individual patient preferences. Section 9. A final word on alpha and beta blockers. Alpha and beta blockers, with their ability to modulate the sympathetic nervous system, have revolutionized the management of various cardiovascular and other health conditions. By understanding their mechanisms of action, clinical uses, and potential side effects, healthcare providers can make informed decisions, tailoring treatment plans to meet the individual needs of each patient. It's crucial to remember that these medications are not a one-size-fits-all solution. Open communication between patients and healthcare providers is paramount, ensuring that medications are used appropriately, side effects are monitored and managed effectively, and treatment plans are adjusted as needed to achieve the best possible outcomes. As with any medication, self-treating is strongly discouraged. If you believe you may benefit from alpha or beta blockers, consult with your healthcare provider to determine the most appropriate course of treatment for your individual needs.